today's directive by President Bola Tinubu on the compulsory implementation of health insurance across all ministries, departments, and agencies in line with the National Health Insurance Authority Act 2022. And on the program, we did bring on Dr. Eze, who is the convener of Make Our Hospitals Work, and he spoke quite extensively on the matter. And we felt that we can't end it just like that. And that's the reason why we decided to bring in the authorities to tell us more.
Right. So we will continue this conversation this morning, and this time from the horse's mouth. So joining us virtually this morning to further look at the mandatory health insurance and the commencement of full implementation across all MDAs, ministries, departments, and agencies is the Director General of the National Health Insurance Authority, Dr. Kelechi Ohiri. Dr. Ohiri, good morning, and thank you for joining us this morning on Kakaaki, the African Voice.
Okay, Doc, are you with us?
Apologies for that.
Dr. Ohiri, can you unmute?
Problem about being muted.
Okay, all right. Okay, I think we can hear you loud and clear now. Yep, we were expecting you yesterday.
Right, thank you very much.
We were expecting you yesterday. Great to see you today. Like they always say, better late than never. Welcome to the program. Now, straight into the discussion itself. We had Dr. Eze, who spoke quite extensively and eloquently on this National Health Insurance Act. Now, Doc, when we heard about what President Tinubu said, this order about making sure that national health insurance is mandatory, a lot of people said, well, we thought it was mandatory before, that they didn't see it as anything new. Perhaps you can tell us what difference what are we about to see being done differently following President Tinubu's order?
Well, first, thank you very much for having me. Again, I apologize that I couldn't be with you yesterday. Yesterday was the conclusion of a 4-day national dialogue on health financing, which I had as the chair of the technical working group of health financing that I led the convening of. And so we were wrapping up and couldn't make it yesterday.
That's all right. You were working for us, so that's all right.
Always ready to. Thank you. So, I mean, on this directive, so what's the issue at hand is that His Excellency, Mr. President, Bola Ahmed Tinubu, has directed the Secretary to the Government of the Federation to issue a service-wide circular to enforce the mandatory nature of the NHIA Act of 2022. And indeed, yeah, the provisions have been made in the law, but there's always a difference between when something is a law and when something gets enforced. And the importance of this particular directive is that it brings the whole of government to enforce something which will benefit every Nigerian in terms of ensuring and driving us closer to universal health coverage. And I think you can look at it in 3 parts. The first part is the one that mandates all federal MDAs to comply with being insured by the NHIA. And so one can say charity begins at home. Most ministries, departments, and agencies already comply with that, as has been identified. But there are some that don't. And so this just makes it very clear that everybody should be insured and how they should get the insurance. Then the second part of it is the enforcement part of it. Now, the NHIA does not have the enforcement powers in and of itself to go around ensuring that everybody has insurance. So at what points can we look and see how we can actually check that enforcement? And it's nothing new, it's not peculiar to the health sector. For instance, before you engage in any public procurement, you need to bring evidence that you've complied with your taxes. You need to bring evidence of compliance with NSITF, and there are other mandates according to the Public Procurement Act. Health insurance is now one of those requirements, so that for those who need permits, who need licenses renewed, who need to participate in federal government public tenders and procurement. It's just to ascertain that those who are doing it have complied with it. So that gives more teeth to the dictates of the act. And this, as you can imagine, is not something that NHIA on its own can do. And if it's something that requires a whole of government approach, then a circular or an explicit directive now has to come from the Secretary to the Government of the Federation. And that was the directive given by Mr. President. So it's now incumbent on NHIA working with all the stakeholders to work out the specific modalities for doing that. And that leads me to the third part of this presidential directive, which focuses on verification. It clearly lays out that NHIA has the responsibility to set up a verification mechanism so that we're sure that whatever health insurance plans that people present complies with the law that says that NHIA must set what the mandatory minimum is, the minimum benefit package of health insurance. And that's so that Nigerians don't get swindled by all sorts of fake health insurance plans that don't cover much. So it has to be one that NHIA has seen and verified and validated that is a valid health insurance plan. So those would be the three main components. First, the compliance part. Second, the part of it that enforces. And third, the how to verify this. And I think this is something that has been very welcomed by most of the stakeholders in the health sector, because that will move us forward as we progress towards ensuring that more Nigerians have benefit from coverage and financial protection from the costs of healthcare.
All right, Dr. Ohiri, we hear you, and I hear you explain that charity begins at home, and that's one of the reasons this is important. And I also hear you give us the 3 steps: compliance, enforcement, and verification. But I'd like to know, when the president mentions that there is a room, there needs to be allowing room for supplementary private coverage when necessary, what does he mean by that?
So what it means is that, first we have to establish what a mandatory minimum would be. And that means this is a minimum benefit package that NHIA, under the guidance of the Federal Ministry of Health, led by the Coordinating Minister of Health and Social Welfare, and stakeholders, have defined what the minimum benefit package should be. And that means what are the things that must be covered, including what's the basic primary health care and referral care should be. So NHIA establishes that. Now, should entities want more coverage than that, then they can take other plans to supplement what they already have. So, and that's why that provision is there, so that you, on one hand, you might prefer a certain plan that covers more and for which you're willing to pay more, because it's, at the end of the day, it's your health care and it's personal to you as well. And so that provision was made there. And this is also consistent with what the NHIA Act actually says. And so what Mr. President was saying was very consistent with the law.
Okay, doesn't this put some responsibility on the NHIA? I'm looking at it from the angle of this basic minimum of how much of this health insurance people should be responsible for. But there's some people that have said, well, look, basic health requirements, we're dealing with issues like malaria, and all that, but these seem to have been overtaken by more serious diseases that are rampant, the likes of your diabetes, your hypertension, and cancer. How are you going to go about coming up with what should be a basic minimum?
So a lot of it has gone through actuarial studies that have been done that look at both the populations that are covered. We look at the prevalence of many diseases, and we also look at the cost of medicines and drugs are available as well. And so the current benefit package does cover both primary care. It also does cover chronic diseases. Now, you will agree with me that at the end of the day, fundamentally, primary care is the bedrock of any health system, and that must be covered. We do not want a system where people only know they have a problem, when they are at advanced stages of a disease. So diabetes is covered, hypertension is covered, the basics, even certain surgical interventions are covered, including things like cesarean sections. If you have an obstetric emergency, these are all covered by it. So it's not, when we say basic, we don't mean it is so
fundamental.
Fundamental that it makes no sense in terms of what real coverage is, right? But of course, it also has to cover the most common things that people suffer from. But then there's a trade-off. It's not going to cover, some of the most sophisticated medical interventions out there, and that's why if because there's a trade-off. If you want to cover those, then of course that means the premium becomes way higher, and at certain points, then it should become whether it's up to you or not. But for the most part, some of the major diseases that affect people are covered.
All
And
right,
then in
then.
addition, sorry,
Then continue.
yeah, there are other programs that have been also put in place. One of the things that the minister also mentioned was things like the Catastrophic Health Insurance Fund, to understand that there are certain conditions that we're seeing are increasingly prevalent and that require an intervention for it. And so, so the Catastrophic Health Fund has been set up, and this will include coverage for certain kinds of cancers, and for chemotherapy. It will include coverage for things like end-stage renal disease and sickle cell disease. These are conditions that are common. And these things have been actuarially determined to see what should be within the benefit package. And what we have is quite substantial, to ensure that most Nigerians are covered. But then there are also other preferences people may have in terms of selection of hospitals, etc., that would necessitate, buying a supplemental should you choose to obtain that. And so it's a balance between, one, ensuring basic coverage, but also not limiting people if they want to get more coverage for other specific things that they might want to get.
All right, let's look at one other directive that the president has given as regards this. He's also mandated NHIA to develop digital platform for seamless verifications of certificates. And he says this is necessary so that transparency and accountability can be guaranteed. So how would this work, and what's to be guaranteed exactly? What's the process of transparency and accountability with this new directive?
Well, thank you. I think that particular part is really important because when you're verifying that somebody is covered, I mean, I shouldn't just be able to go somewhere, print a certificate, or go somewhere and say, well, I have health insurance coverage, and present it for the purposes of, let's say, transaction with government. How will that entity verify that this is real and versus this is not real? If we count it and say, so the transparency part means that the MDA or enforcing MDA should be able to verify that electronically through a platform that is set up by NHIA, to know that, one, this is authentic and that this covers the person. Recall, the primary purpose of this is not to create additional bottlenecks. The primary purpose of this is to make sure that people are truly covered for healthcare. And because we know that a healthy employee is a productive employee, and being able to ensure that people are not swindled and people have the right plans, that is what this verification is meant for. And so NHIA will now have to go and start working on it. So the platform is not yet ready. So this is something that NHIA, in consultation with stakeholders, will need to develop in order to make sure that we can verify this once this becomes enforced and once we start. But the next step will be, of course, engaging with our stakeholders and understanding a bit better the business processes so that whatever we design is fit for purpose and is as minimally disruptive as possible.
Okay, I guess this is all geared towards achieving what we can call universal health coverage. I guess no health coverage is absolutely universal, but it's to try and get as more people on board as possible. Now, let's look at the challenges you're likely to face in bringing in the informal sector. And when I say informal sector, I mean real informal sector. People doing suya, people frying akara. We're all entitled to good health. Um, what, how do you intend to bring these kind of people on board in the long run?
Now, if you look at the population segment, if you look at that population, let's say there are just three categories of people, right? And you're absolutely right in that that's in every country tends to be the most challenging segment of the population. There are those that have regular jobs that you can deduct from salaries or at least track payroll. So the formal sector, those are the easiest of the law of every segment of the population to capture, and that's why for the last 20 years the NHIA had largely catered to the private sector, to the large private sector, as well as the public sector. Then there are those who, no matter what, would need help. They will not be able to even pay the premiums that we're asking for. That's why the government has started a lot of equity programs targeted at them. So there are people who, would need subventions or governments to pay on their behalf. So the Basic Healthcare Provision Fund, for instance, where the federal government commits 1% of its consolidated revenue to primary care. Half of that goes through the insurance pathway, where we work with our states to ensure that they identify the poor and vulnerable in the communities and that they are covered. At the moment, about 2.7 million Nigerians are already covered from that. These are not people that you would easily find. These are people that, through working with the National Social Register and doing some community-based targeting, you have to find. In addition, we recognize that there are people that still can't afford care, they're not covered. And that's why the federal government started some of these programs targeted at reducing the high burden of maternal mortality. And so we started the program to provide free emergency obstetric care across the country, where if a pregnant woman is in labor and develops life-threatening complications, then just show up, and our instruction is do not send her away or delay treatment on account of inability to pay. So treat her, and then we can insure her afterwards through the Vulnerable Group Fund. So far, about over 13,000 women since this program started last October have benefited from this program across over 200 facilities in the country, in every state in the country, and more are being onboarded so far. And we've extended the same thing to women with obstetric fistula, and where about over 3,000 women have had fistulas repaired. Now, in these cases, these are people that are largely informal, but they also do not have the ability to pay for such care, and we believe that delay can be fatal, so they are being taken care of. So we keep them alive, solve the problem they come with, and then we can then enroll them in insurance afterwards. And now we have started pilots looking at newborns, because 40% of infants mortality in Nigeria is linked to neonatal death. And so we've started piloting it so that we will gradually begin to roll that out in some public and a large private hospital group. Now, but apart from those two groups, there's a large informal sector, which is which is a big segment of our population. This includes the suya seller, this includes the vulcanizer, this also includes some people who run their own businesses, but they are entrepreneurs. Now, for that segment, it's not a homogeneous, it's not one segment, there are different types. Some of them with this mandate will fall into that. There are people that are contractors that are dealing with government. There are people that need to renew licenses. There are people that may require permits for different things to happen, and they will come under that bracket. For the others, we will need to actively create awareness and engage them. Now, many of these artisans, many of our informal sector are also organized in associations, be they plumbers or mechanics or painters or vulcanizers, you find out, or even market women or traders in the market. They are all organized. And so we started working with the ILO and with the informal sector department in the NHIA We've started piloting in a few states in how we will begin to engage through their associations to get their members together. There's a lot of advocacy that needs to happen. But also, a payment mechanism has to be more flexible than the traditional, because they might earn 100 naira today, 1,000 naira tomorrow, not earn anything. So there's unpredictability in how they earn money. So there's a program that is a bit more flexible for some of them will be relevant. But one good entry point will be through the associations as they organize themselves. Because people are very organized in Nigeria, and the informal sector is not as informal as we think they are. They are informal in the nature of their jobs, but in terms of structure, we can work with existing associations to actually reach them.
Okay, what are the results? Sorry, Doc. You said you're working with some of these associations already. What are the results like? How has the response been?
So it's been encouraging, but what we found is that some of the challenges is the way they pay, right? So for instance, imagine if we go out on some of our outreach, which we do to churches, and my teams do that. And then they say, okay, yes, we're ready to sign up now. The next thing we'll tell them is, okay, fine, come to the NHIA office and sign up. And then that already creates a barrier, because by the time they get around to doing it, that'll be difficult. And that's why the NHIA worked and now have a self-enrollment platform online where people, and I wish I had it, earlier I was going to bring the QR code, but I promised to send it to you afterwards, where you can go and register online immediately, so that in the comfort of your house or your room or wherever, you can go and sign up for health insurance. And
how does the man on the street access that?
The thing that will be required will just be your NIN. And the man on the street can, there are many ways, right? So we're also trying to create a mobile platform, a mobile app that can easily be accessed. We're trying to create flyers that can be distributed across some of the hospitals where we work, so that you can access that. You can also still walk into the NHIA office anywhere in every state. We're in every state in the country. But the insurance you need to get is not just that of NHIA. You can get from the state health insurance schemes that run programs. You can get from any accredited HMO. So there are different options for getting health insurance. But indeed, a lot of awareness needs to happen. And I think that's one of the things that came out in this 4-day dialogue, where it started first with discussing with civil society and with the media on the need for all of us collectively to do more to educate and empower Nigerian citizens, for the common man on the street. And when we started the dialogue, we began with the voices of the common man on the streets. Some of them, whether they've heard of insurance, some of them, whether they've not, some of them also looking at some of the challenges they face in healthcare. And so we spent half a day with civil society groups and with the media, and all came out with a reaffirmation of the need for us to have collective responsibility in terms of informing and enlightening people, not just to get health insurance, but even when you get it, to know what you're entitled to, and to also be sure that whenever whatever you're entitled to doesn't come to you, what are your causes of your opportunities for redress?
Okay.
So that's something that we have all aligned on to do.
All right.
And then we have, yeah.
So you mentioned when you started, you gave us some requirements like health insurance certificates before you get access to these, renewing licenses, permits, and other official approvals. So I'd like to know what sort of closer or even constructive engagement will be in place so that private sector, we don't have businesses, we don't prevent businesses from being unduly constrained by this new requirement.
That's excellent. And if you notice, one of the directive from His Excellency Mr. President was the need to engage the private sector even further, right? And I think we need to go from a point where we look at health care or access to health care, which is what this is really, as not being a burden, but being something that creates better, healthier, and productive employees that will add to your bottom line and to your profitability as a business.
Right.
If your employees are falling sick all the time with malaria, they can't afford it, so they need money, the outcomes are worse, it does not help your business. And so there is a lot of there's more consultation, and one of the members of the board of NHIA is NECA, the Employers Consultative Association, and that was intentional for a reason. It's so that the private sector and the Nigerian businesses will see that this enhances productivity and is not an additional tax on them, because this caters to their own workers, and the workers are the business in essence. And so that awareness, consultation, and some education so that we understand why we're doing this is important. Insurance shouldn't be construed as another levy or another tax, because the benefits are to the employee and not to us. And it is facilitating our access to healthcare. So that at that moment of vulnerability, inability to pay should not be what will prevent you. Okay. I mean, even if you have the money and can pay, you can't always assure yourself that at 2 a.m., God forbid, something happens, that you can actually find money around you to go and get care.
All right,
and
Dr. Ohiri. Yes, the part
okay,
of it being whether it's for taxes, more taxes would have been our next part of conversation, but we have to run because the time is against us now. So we thank you, Director General of the National Health Insurance Authority, Dr. Kelechi Ohiri.
And like we said, we got a good deal yesterday with Dr. Eze. It looks as if we've done an equally good deal with Dr. Ohiri. Many thanks for your time and useful insight, and wish you all the best as you push this thing forward.
And do have a nice day.
Thank you very much for having me, and have a wonderful day.